Hello, everyone, and welcome to our monthly community podcast. My name is Aimee, Health Promotion Specialist here with Siouxland District Health Department. Now, September is Emergency Preparedness Month, and today joining us to talk about emergency preparedness, what it is, and how it affects us all is Emergency Preparedness Grant Coordinator Aimee Ewell. So welcome, Aimee.
Thank you for having me.
Thank you for joining. Would you be able to tell us a little bit more about yourself and how long you've been with the health department?
Yes, so like you said, I'm an Emergency Preparedness Grant Coordinator. I think I've been with the health department for approximately 8 years, but I've been in this role for probably right around 5 years.
Okay. Still quite a while.
Yes.
Sometimes it feels like it.
Yes, for sure.
So like I mentioned, September is Emergency Preparedness Month.
It is.
So can you tell us what emergency preparedness is and what is its role in public health?
Yeah, so emergency preparedness would just be those steps that you take to ensure that your family is safe either before, during, or after a disaster. As far as public health's role in emergency preparedness, it's basically just to assess and help improve the community's ability to prepare and respond to emergencies that would affect the health of the community. So if you think back to COVID-19, that's the perfect example because public health's main role was responding to COVID-19. And people often would refer to public health as the subject matter experts.
Yeah,
when it came to COVID.
Definitely. I think that's the biggest one that people think of when it comes to an emergency, right? So what should the community know about emergency preparedness and what steps can they ensure to make sure that they are ready for an emergency?
Yeah, so I would suggest that they know what hazards could affect them within their community or their household. So severe storms, tornadoes, snowstorms, blizzards, fires, things like that. Then I would recommend that they make a plan and practice it. So, for example, does your family know where to go if there's a tornado? Do you have an escape route if there is a fire? Do you have emergency phone numbers displayed within your household so that if something were to happen, if your kids are home alone after school, that they would know who to contact if there was a situation? And then have a supply of water or non-perishable food items within your house, because we always think about when there's a snowstorm or a blizzard, what is the first thing that people do? They run to the grocery stores, and then our grocery store shelves are cleared out of bread and milk because we think that that's what we need during a situation. But what happens if those grocery stores can't get restocked for a long period of time? You know, we're seeing supply chain shortages now still from COVID-19, but we think back to during COVID when we couldn't get toilet paper. So what happens if we can't get some of those necessities, such as food or water or non-perishable food items? So have kind of a small supply of that on hand, and then stay informed. So, you know, if your community has text alert systems, sign up for those, and maybe a weather radio, and have some new batteries. Make sure to have batteries on hand. So those are just some ideas.
Yeah, so I mean, we don't always, expect an emergency to happen, but it's always good to be prepared just in case it does, and have those plans in place for different types of disasters, not just something for like COVID-19, which was, very unexpected in our community.
Right.
So emergency preparedness is a community effort, and other organizations around Northwest Iowa participate in our healthcare coalition. Can you tell us a little bit more about what that coalition is all about?
Right. So the healthcare coalition is who I work with directly, and they are basically a network of healthcare organizations that kind of come together and they respond and coordinate and plan to prepare the community for a disaster. So they would work to train and exercise together. And that group consists of public health, hospital, emergency management, and EMS, so emergency medical services. Mm-hmm. So that group collaborates and just ensures that the community has all the necessary medical equipment, supplies, real-time information, and the trained personnel to respond to an emergency.
Okay. So who should the public contact if they want to know more about the Healthcare Coalition or just emergency preparedness in general?
Yeah, so they can call here at the health department and ask for me, and I can give them information about the coalition if that's something that they're interested in or interested in participating in if they're part of these entities.
Right.
If they are just curious about the emergency preparedness in general within their community, they can definitely reach out to their local emergency manager. Here in Woodbury County, it's Mike Montino, and he is out at the Security Institute at Western Iowa Tech, or their local emergency manager.
Where would one find that information?
I think that we have it on our website here at the health department. Otherwise, each emergency manager has a website or their contact information.
Can they
is
just,
usually,
Google emergency manager for
their
such
county.
and such county?
Yep.
Okay.
Yep.
Is there anything else that you would like to add or think is important that the public should know?
Yeah, so again, I mentioned signing up for those alert systems within your community, and then know what the sirens mean within your community, because we know that a tornado warning siren is a little bit different than if it was a severe storm, or know why those sirens are going off within your community. And have conversations within your family and your household and identify what roles each one of you would play if there was a disaster and an emergency within your household. And then if anyone in your family has any sort of disability or special need, make sure that you're planning for that as well, as far as medications or oxygen needs, things like that, because those could be some difficult things to get access to if your house was destroyed in a tornado. And then the last thing I would recommend is get trained in CPR, yourself, your family, your kids. I've taught my 14-year-old CPR because we have a family history of heart attacks. So I want her to be prepared. So
definitely.
I strongly recommend that within your family.
Is there a certain age you maybe suggest talking to your kids about emergency preparedness?
I feel like kids are never too young to talk about where to go if there's a fire, where to go if there's a tornado. They're learning it in school. Yeah. They're practicing it in school. So have those conversations at home.
Awesome. Yeah, most definitely. Well, thank you once again, Aimee, for joining us. If you have any additional questions, concerns, feel free to give us a call, 712-279-6119. Thank you.
Thanks.